Hi everyone, Al the Psych here. Today I'm going to be talking about trauma and some treatment options. And as usual, everything I talk about is for informational purposes only. Go ahead and do your own due diligence. Okay, so with trauma, we're going to talk about PTSD, post-traumatic stress disorder. And I've got a definition that I'm going to read. I took it from mayoclinic.org. So post-traumatic stress disorder, PTSD, is a mental health condition that's triggered by a terrifying event, either experiencing it or witnessing it. Symptoms may include flashbacks, nightmares, severe anxiety, as well as uncontrollable thoughts about the event. Now, most people who go through traumatic events may have temporary difficulty adjusting and coping, but as time goes on, they're able to adjust. They usually get better. Now, if the symptoms get worse and last for months or even years and interfere with your daily living routine and functioning, then you may have PTSD. Okay, so now as I was doing my research, I was initially thinking I was just going to do a quick little summary and that would be it in terms of trauma. But it's just so involved that what I'm going to do is I'll do a brief summary on this presentation, and then down the road I'll do a lot of other more focused types of videos with real specific subject matter, so a little bit more narrowly focused as opposed to broadly focused. Okay, so I've taken information from several sources. A few months ago I did a online workshop with Eric Gentry as the presenter. I've read different books. Linda Graham, her book is called Bouncing Back from 2013. We got a book from Glenn Schiraldi, the Post-Traumatic Stress Disorder Workbook, that's from the year 2000. Different articles and research that I've read kind of just goes into filling the information that I'm presenting. So we have an idea of what PTSD is. So how do we go about treating it? Okay, so if you're a therapist, there are three tenets basically that you need to be operating off of. And the first one is developing and maintaining a strong therapeutic alliance. And the therapist does this, at least in part, by exuding hope, and the term that Eric Gentry used was positive expectancy. Okay, so you're going to let your client know that, yeah, we are going to see some positive results, or at least the odds are very good that we're going to do that. And in a previous video, I talked about the importance of a therapeutic alliance, and you may just want to look that up on your own in terms of the importance of therapeutic alliance. Point number two would be having to teach, if you're the therapist, teaching your client how to relax their bodies, especially in the context of a perceived threat. Okay, so that's very important. These are three very important tenets I'm going over. The third is you help your client construct complete chronological narratives of their traumatic experiences. The completion of these three tasks can very likely heal traumatic stress. Now, my own personal thoughts about dealing with trauma. If you are going solo, you're not working with a therapist, you do have to be careful. I know there's a lot of self-help books out there and things that you can read on the internet, things like that. But you have to be careful in terms of avoiding re-traumatizing yourself or sensitizing yourself even beyond what you're experiencing presently. So, and that's especially true, like if you're kind of looking back and doing some reconstruction of the event. If I were just kind of working on my own without a therapist, I would really work on just learning to relax on cue, maybe naming my feelings. I wouldn't be doing any backward looking sorts of self-therapy. It would be more like forward looking at what are the issues that I'm dealing with as I'm going forward and addressing those. But again, information that I'm presenting to you is for informational purposes only. Yeah, if you have a therapist, that's going to be a good starting point. Okay, so let's go back to PTSD in terms of what it is. Okay, I gave a definition, but it's also, beyond that, it's a physiological problem. So if you stay stuck in a high physiological way during a traumatic event, you're increasing the likelihood of becoming traumatized. So I think that's important to remember. Now, there's something called negativity bias. This is when the brain, it's basically the lower portion of your brain, it encodes negative fear-based memories more readily into our unconscious memory than positive ones. Then I'm sure that has to do with, as we evolved as a human race, it was kind of like a safety device, just kind of being on alert and, making sure that we were safe. Here's something from Linda Graham from Bouncing Back, her book. Once we perceive difficult patterns without anxiety, we can work to rewire them. So, let me read that again. Once we perceive difficult patterns without anxiety, we can work to rewire them. So that goes back to point number 2, about learning to relax your body, especially in the context of a perceived threat. In fact, I'm going to go over those 3 points again. Again, this is more like if you're a therapist, it's like, number 1, develop and maintain a strong therapeutic alliance with your client. And if you're the client, hopefully you're going to feel that sense of connection with your therapist. You're going to feel that there's some hope there, and that there's some positive expectations that you can actually achieve. Number 2 is learning to relax your body, especially in the context of a perceived threat. And number 3 is helping, if you're the therapist, helping your client construct complete chronological narratives of the traumatic experiences. So these 3 things are really important. Now, I'm going to talk a little bit about point number 3 a little bit, but let me go over some more information. Okay, the idea that trauma narratives are fragmented and become more organized over the course of treatment. It's a common clinical assumption that therapists often present as part of the rationale for treatment. Can't remember where I got that from, but I took that straight from that particular source. So the idea is that narrative memory is encoded in language in the hippocampus. Okay, a little structure in the brain there. It's kind of like a memory relay station. Implicit memory is encoded by physiology and sensory via the amygdala. That's part of the limbic system. Okay. Now, in trauma, narrative memory is not being encoded, but implicit memory is. So the idea is that part of the treatment is being able to put words to our experience. And that way we can kind of reprocess the event that happened. We can get rid of some of those fragments in terms of our memory. Now, the APA says by expressing the narrative, the patient fills in details of fragmentary memories and develops a coherent autobiographical story. In so doing, the memory of a traumatic episode is refined and understood. Okay, so now that's kind of like the standard in terms of working with on trauma and trying to overcome trauma. That's point number 3. Interesting thing about psychology, though, is there's a lot of studies out there, and sometimes we get some conflicting information. And I was looking at some information, looking at some studies, and I came upon this. The title is Trauma Memory Special: Trauma Narrative Fragmentation in PTSD. Effects of treatment and response. And this was published online in March 2017. And what it says, summary of that particular research article was, fragmentation is poorly understood despite theories on its clinical and theoretical importance to PTSD. And they reference Bruin of 2013 and Vanderkolk 2014. And then they say, our findings were inconsistent with hypotheses that narrative-focused therapy would lead to greater fragmentation decreases than pharmacotherapy, and that treatment responders would show greater decreases in fragmentation than non-responders. So accordingly, fragmentation may not be a crucial mechanism in PTSD treatment, and other explanations of change, such as those emphasizing meaning and new learning, should be emphasized. So, okay, just to be clear, I'm giving you kind of like 2 different messages here. I mentioned the 3 points of importance. The therapeutic alliance, learning to relax your body, and the narrative. And so now this research is saying, well, the narrative part may not be as important as we were thinking. Okay, so that might be a little bit confusing. So in my mind, my thought would be, especially if you're going solo, if you've got a therapist, great. You can work with your therapist on these things. But if you're going solo, my thought would be to really practice relaxation and getting to the point. I'd be practicing it several times a day, learning how to relax, so you can quickly get in a relaxed mode, and then when you get in that relaxed mode, then you can slowly start pairing, stressful situations with that relaxed mode. The idea is that if you're relaxed, you're not going to be able to feel stressed. And that's going to be a whole different presentation that I hope to get out quickly. But to summarize, the 3 important things, I've said it before, but I'm going to repeat it again. Therapeutic alliance is very important if you're dealing with trauma and you're seeing a therapist. Being able to relax your body is going to be very important. And then the constructing the narrative, putting words to what you experienced is the 3rd tenet. And with that, I also presented that there seems to be some information that's saying, okay, maybe it's not quite as important as we thought. different ways of thinking about it. So we have all that information, and I'll be adding other videos. The next one I think will be specifically on relaxation strategies. So I hope this at the very least gives you something to think about, and go ahead and do a little bit more research on your own and see what you come up with. If you've got some concerns, go ahead and put them in the comments. Okay, thank you.